so.
Okay, perfect.
Yeah.
So happy New Year, everyone. Thanks for tuning in.
Happy New Year, and the sun is shining.
Yes,
I know. The sun is shining. It's a little cold out there, but at least the sun's shining. But happy New Year. We wanted to jump in to talk a little bit about the top non-invasive aesthetic treatments that have been very popular over the last several years and have gained more popularity in recent years because technologies have improved. Technology, as everyone knows, is constantly improving. I mean, for those of you that have iPhones, you know, iPhones are modified and changed almost like on an annual basis, I feel. So technology is always improving, and the good thing for those interested in aesthetic treatments or receiving aesthetic treatments to maintain the quality and the health of their skin, they know that there's a lot less downtime now. Many of the technologies that are available don't produce any downtime, and it's pretty awesome. So we thought we would just come live and talk to you guys a little bit about some of those top treatments. We get lots of questions that are very similar from patients and new clients that come in, so we thought we'd kind of throw those questions out here and get them answered because the audience might have those types of questions as well. So we're just going to get down to the nitty gritty, and I think we'll kind of cover injectables, we'll cover laser treatments as well, and Dr. Josie will talk a little bit about you know, what the difference is and why. I know that there's a lot of patients that call, especially during consults, that don't know, like, why would they need laser versus injectables? Do they need both? What's the difference? And so maybe we'll kind of get started there.
Perfect. So for the most part, you know, everyone, no matter how, you know, where in the journey you are, we always start with looking at the skin first. So I chose Jenna today as my model because she's really has done a lot of the work that we start to do with the skin first. Because if you think about a balloon, you know, if you try to blow up one of those really stiff balloons, it's really hard to get anything in, no air in there. But when you have a balloon that has sort of more stretchability, then it's easier to work with it. And the skin's kind of similar in that we want it to be nice and pristine. And so we usually assess the skin to make sure, you know, where is it with its journey. And we utilize, you know, I don't even use the term skincare products anymore because it's really more things that change the skin is more of a, you know, sort of, it's a transformational product as opposed to just something you put on the skin to create moisture. So, you know, Jenna's done some of the non-invasive and even one of the more invasive procedures to get the skin looking really fresh. And so her skin is really in great condition. And, you know, when I talk about aging, I do talk about the changes that happen to the skin. And one of the analogies I like to give is picture a tablecloth, you know, when it's a nice foam tablecloth, you know, when it's fresh out of the bag, there's no red wine stains on it, there's no chocolate stains on it, it's nice and foamy and juicy, it lies perfectly flat on the head or on the table, and so you don't really see any flaws. And so that's really what we've kind of done with Jenna's skin is we've revitalize that tablecloth, and now we sort of look at what else happens to us as we age. You know, when we're young, we've got very thick bone, we've got a lot of thick muscle, we have a lot of fat that sits on the bone to kind of give us our curves, and we talk about volume. So when we talk about, you know, volume loss, what we're really saying is that some of the fat pads that sit on the bone have kind of shriveled up a little bit and we need to plump them up again. But I think, Natalia, you were telling me that one of the most common questions is what's the difference between
Botox and filler, or why would you need both? You know, like what?
Yeah, so I thought I would jump into that one because that's sort of the next step after skin is that what Botox or neuromodulators do, and there's 4 of them on the marketplace now, is they allow the muscle to relax so that you can't really frown so much, therefore you can't make those either number 1 or the 11s, and if Jenna goes to try to frown, she does not really have a lot of frownability, and so because we use a little bit of Botox to allow the skin to kind of be more relaxed so it lies flat. Now, fillers are more something that will create that lost volume. So it's a structural thing. So you want to utilize that when you've done an assessment and there has been some evidence where we tend to lose volume. So you can't really do that with neuromodulators because they just relax the skin. So
yeah, it's interesting because it is. A lot of people ask that question. And also we get the question of, I don't want to look frozen. Although we do have some patients that don't want to move. They want that frozen look. Yeah, that's their goal. Everyone has a different goal. Collectively here, in terms of like what our philosophy is that we want to age gracefully, utilizing the tools that we have. So the non-invasive tools that we have. And again, when clients are coming in, there's always, if they haven't experienced any of the cosmetic procedures, there's always a little bit of time that we have to kind of get into that corrective phase, that we're trying to get their the damage in their skin cleared up. We want to get that kind of skin, the quality of the skin, to the optimum, optimally performing, and solidifying that collagen and the elastin that's kind of loosened up there. We want to get that as firm as we possibly can, so we've got technology for that. And then, as Dr. Josie had mentioned, we have the dermal filler that can be injected properly into the skin when somebody knows what they're doing. Product placement is everything, but when you place it properly, it really gives you some really nice natural looking results. And so that's what people fear. They don't want to look like a version that's like a fake version that's not themselves. And the goal here is to have you look your age, but have you look really refreshed. And so, that's what we're all about here at Fresh Skin. So yes, the Botox and neuromodulators help with relaxing the harsh movement of the muscle so that you don't create those dynamic wrinkles in the lines. And then the filler helps with increasing volume. So I have personally not experienced filler. One time when I was 29, a little bit in the lip, that was it. So I personally have not experienced filler yet. But again, what's been important for me and my goals is to really work on the quality of my skin, and then I'll move into the phase of volumizers and things like that.
Right, and that journey is like unique to everybody. It's like we often have people say, I'm a baby, and I'm like, we specialize in babies. Because the journey is, it doesn't have to be overnight, and usually some people like to start just with skincare products, and then they say, okay, now what? And then we could utilize some, laser type treatments that deliver heat to the skin, that creates collagen and tightens everything up. And then they move on to, maybe I'd like to have more uneven tone. And then we move on to other lasers that, will help to get rid of some of the brown spots and some of the broken blood vessels, or other people have some rosacea, and we can use the lasers to get that to go into remission. Yeah. And so that journey, it's a journey. And so eventually most people say, okay, now what's next? And I'm ready. And then we start to do a little bit of the neuromodulators. And then we come into, okay, now let's look at how have you aged? And really what I tend to do is I tell people I don't do Botox, I don't do fillers. And they look at me like, well, why am I here? And I'm like, I create youth and beauty. I restore youth and beauty. I utilize neuromodulators and fillers as my tools in my toolbox, but I'm not trying to create something that isn't you. Right. So it's more like, let's look at what's happened to you. If we look at Jenna, she's lost a little volume in her temples. She's lost a little volume in the mid cheek. But her jawline is fabulous. I mean, if you turn to the sides, this might look
well, that was legacy though.
Yeah, so her jawline, but she's utilized the, radio frequency treatments to create some tightness here. So she does have a lot of great features and a lot of nice tight skin. And so now really when we're going to restore a little bit, young women have a little bit more of a convexity, so sticking out to the temples.
Like thumbprints, like someone just like stuck thumbprints in there.
So to restore that's going to give her face a little bit more balance. And when we restore the mid cheek and a little bit in here, that just kind of makes the under eye look less of a shadow, and so it'll make her look a little bit more refreshed. So she'll look exactly like the beautiful Jenna that she is, but she'll just look like, you know, she went on vacation, or she had a
good sleep,
and she's, you know, and she's in a great mood and all that kind of stuff. So it's really, that's sort of my artistry, is I never want anyone to say, oh my God, what did you have done to your face? It's more like, did you go on vacation? Or my favorite is, did you lose weight? It's always about that. So that's sort of where we go for that. And then if you look at that box of products that I have for fillers, we've got everything that's doesn't last very long at all, to products like, you know, Bellafill here that lasts up to 5 years, if not longer, if placed in the right spot. So we do have a lot of tools, and again, we like to start on like the corrective, and then once we get her restored, then, you know, the journey doesn't end there, because then it's sort of like, how do we keep you looking your best? And then we do some maintenance laser work, we do some maintenance filler work from time to time, a little Botox and neuromodulators, whichever one we utilize with you, just to keep you looking your best without sort of ever losing, you know, the secret that you're not quite as old as everyone thinks you are, or you are. Everyone thinks that you're younger. That's what I meant to say.
It's interesting because there are people, you know, that will come in, and a common question is like, well, if I do this, do I have to come back? And it's like, well, you're going to continue to age. It's the same thing. I use this analogy a lot in the consultations, is when someone is going to the gym. So let's talk about Legacy. Legacy is a radio frequency device. It feels, I've experienced Legacy, and that's one of the laser treatments, not really a true laser, but that I started with.
Energy.
It's an energy-based.
It's an energy device, yeah.
Yes,
energy
because it's radio frequency. It doesn't resurface the skin in any way, but it helps with boosting the collagen and the elastin in the skin. And that was important to me because I started seeing some crepiness around the eyes and a little bit here. And that's why I chose to do Legacy. What was interesting is that I was at dinner at my mom's house one night. She goes, oh, it looks really good. And that little pouch you had here went away. And I'm like,
what pouch?
Yeah, literally. I'm like, I didn't have a pouch. But who looks at their profile? I can't see my profile. And I didn't realize that, you know, with aging and estrogen, that you start jowling a little bit, and there's a little bit of a pouch there. Now, I have my before and after photos that, you know, we take so that we can kind of clinically look at how everything is going. And I didn't notice the response and the results. And I never saw that pouch until I saw my before and after side by side, and I realized what a difference that made, because it truly did lift. It helped with the neck, and it helped create that lift. And so the before and afters are actually on our website under skin tightening if you want to check them out. But anyway, but it's interesting because when you're getting services done, for example, the Legacy, it's a workout. I call it a workout for the skin, because it takes a little bit of time and it takes a little bit of commitment, not a lot of commitment.
It's like going to the gym.
Yeah.
It takes about 6 weeks.
Exactly. And then once you're done, then you just maintain it every once in a while. And so being consistent and maintaining it is key to anything, but it doesn't have to be complicated. It could be very, very simple. Anyway, so let's talk about... let's talk about, so the different types of lasers. So we just talked about Legacy, which is radio frequency energy, and it feels like kind of like a warming device, and it just feels kind of like a hot stone massage. I've also done it on my body as well, to help with a little bit of contouring and skin tightening. I was getting, I wouldn't call it cellulite in the thighs, but some sort of like dimpling or weird. It wasn't like smooth, I guess.
Yeah, when you have tissue laxity, it starts to, so laxity is looseness. It starts to resemble cellulite, and you'll know if it's loose, but if you pull up on the skin and the little dimpling goes away, then you know the skin is just loose. It's not a true cellulite dimple, which is actually something holding the skin back and tethering it. So, you know, so that Legacy really helps a lot.
Yeah, so I was doing that, and it made me feel so much better. I was wearing shorts again, and I'd aged, so that was good. But one of my personal challenges, and again, everyone also, there are times when people will come in and be like, well, I want what my friend had, or, which is great, and on many occasions we can accommodate that, but everyone's so different. You know, we have our aesthetic medicine side of the practice. We also have our wellness side of the practice, where we take care of internal health. And it's rooted more in functional medicine and integrative medicine. But I had hormone issues that started back in my mid-30s, pretty significant, that normally I shouldn't have experienced until my mid-40s, early 50s. And so that kind of set me in the early or the quick aging process. Like I started aging a little bit earlier. So, and I noticed that in the quality of my skin, and that was an insecurity of mine. But anyway, so legacy radiofrequency is something that is like a workout for the skin because it helps with really strengthening the structure of your skin. There's other services. I've had Subnovi done. Subnovi is a plasma device that we have. It's advanced plasma technology because it utilizes low frequency energy so that the energy isn't as sporadic and it doesn't arc as much as typical like plasma pens would. It's more of an even arc, so it delivers better energy, deeper energy, and it's more consistent.
With fewer days to heal.
Exactly, fewer days to heal. And so that I guess we can classify under some sort of a resurfacing type of
it really
product.
activates those cells that tell the body to make collagen and elastic tissue, and it just, you can actually see when we do the treatment, you can actually see the skin shrink.
Yeah,
which is really,
it's really,
cool.
really neat. So we've got some really good Subnovi. If anyone has concerns, it's really great for the eye area, or if there's vertical lines around the lip or the front of the neck. And we have some good before and afters on our website for Subnovi as well. There's also different skin resurfacing treatments. If we talk about, there's Arctic peel, micro laser peel, profractional, deep resurfacing, and you know that targets different levels and different depths in the skin, right? So
and
we can do really light resurfacing, and we can do something deep.
So there's certain things that need something like a profractional, acne, scarring, or melasma, which is a skin condition where there's deep pigment in the skin that just won't leave the skin unless you facilitate a way for the pigment to leave the skin. And then there's, like you say, a light, almost a 24-hour light peel that's kind of like having a chemical peel, only more precise. And there's various levels of depth that we can utilize. And so we're really blessed here in this practice in that we have a device that can be very precise in how deep we want to go. And I usually, depending on the skin, I mean, some people do need a deep resurfacing because they've got leathery, thick, very sun-damaged skin. And there's, we can't deliver great results without doing that. And then other people would do extremely well with a light resurfacing and either some Subnovi or some Legacy, or even just our laser rejuvenation device, which is like having a blow dryer blow on your skin, and that also does a very nice job with tightening. So we have a lot of tools in the skin, in the laser world, and so I typically use the term energy-based because all of them use some form of energy that really works well at allowing the skin to have as much collagen production, as much elasticity production as possible. I mean, there was a time we used to think you get a certain age, you didn't make collagen anymore, and that's actually not true. We've learned that if we can make the skin healthy, those cells that make collagen stretch out and they manufacture collagen even late in life. So that's actually, sort of the new science and the technology. So
and we have BBL, photo rejuvenation too.
Right, so, and that's really focuses on the pigmentation and putting rosacea into remission. It can actually do that, which is, you do enough of them, and it's for people who do struggle with rosacea. A lot of people don't even know that there are these treatments available to do that. So, we can actually affect medical conditions as well as just something that you're coming in just to look like you have better skin. So
I guess like going back to the different classifications to kind of summarize a little bit, we have the laser or energy-based devices that really help work on the quality of the skin structure. So it helps with improving texture, fine lines and wrinkles, like you were saying, leathery skin, age spots, sun damage, broken capillaries, reds and browns in the skin. We can do a lot in that respect. And normally what we like to do is kind of start there, would be the starting point. Like, let's get the skin back to its healthiest state, and then we can build on that. And we can build on that with a variety of different dermal fillers and also the neuromodulators that we talked about with help relaxing the muscles so that we don't create those static wrinkles with the dynamic movement that we have. But I want to touch on now, and I want to go a little bit more into dermal fillers, because dermal fillers range from, there's HA fillers, and then we go into, there's Sculptra, and then we go into Bellafill, which is our longer lasting filler. And so the nice thing about working here is that Dr. Josie, she has an artistic background, which is pretty fantastic, because you actually look at the skin and look at the structure in a different way. I've been in the industry for a while, and I've worked with many doctors that have been amazing, but I really like the way that you look at the skin. And then she has her whole arsenal of filler that she can utilize, so that she knows where to place it and how to place it for each individual. So it's truly a customized process. So let's talk a little bit about, I guess let's start with HA filler, and like, what's the difference between all the fillers? There's the Restylane family, Juvederm family.
Right, so there's the Restylane family, manufactured by Galderma, and they are hyaluronic acid fillers. And so there are different types, even within that family, because some of them are very soft and supple, and they're appropriate for lips, and others are, integrate a little bit more with the skin, and so they're more appropriate for dealing with areas where the face moves. So anything that has, like in this area, underlying muscles that pull on it, you want something that's going to move. You've got the other family, which is the Allergan family that manufactures Juvederm. So a lot of people, when they say I had Juvederm, well, there's a lot of different forms of Juvederm. There's, stiffer Juvederm there that we use to recreate or restructure the cheeks. We have softer Juvederm that we can just sort of, I do what's called a lip glossing technique that just kind of irons out the wrinkles in the lips without making them look ducky. And so all of those are HA fillers. And so we have hyaluronic acid in our skin, in our bones, in our joints, everywhere. And the body sort of knows that it's sort of similar. It's not animal based, so there's really no allergy testing that's required. And they have found a way to cross-link the little fibers in it so that they can be fairly long lasting. But they are, eventually the body will remove them, and some of them, especially some of the ones that are a little bit more long lasting, will stimulate your own body to create some of your own collagen. So you're kind of left with a better result. Because a lot of people say, well, when they go away, am I going to look worse? No, actually you're not, because I often see when I do put filler, the HA fillers in, the quality of the skin improves, because you are getting a little bit of collagen stimulation. And then there are other products that we use. We don't really call them fillers, they're more volumizers, and I tend to utilize them when I have a lot of areas that have volume loss. So if I want to hit temples and in front of the cheek and mid cheek, and if doing a lot, I like to use a product called Sculptra, which is actually 100% converted from the product to your own collagen, to kind of do a little bit of a deep fill for those individuals who need a little bit more of that structure support.
Yeah.
And then you can ice it. And so we have, the Juvederm found the Galderma, and then for those...
Meaning the icing on the cake.
The icing on the cake, on my Sculptra cake. And then we have, individuals who, don't, and when we put fillers in, we use little small needles, and there are people who don't really want to have that done frequently. And so we do have a longer lasting product that's actually a little bit of a combination of volumizer and filler. It's called Bellafill, right there. It's actually FDA approved for acne scarring, because it's got a little bit of an implant, and the little particles in it are called PMMA, and they allow your body to stimulate your own collagen. So where you place it is where it stays. It doesn't migrate or go anywhere, and it gradually over time will stimulate your body to manufacture its own collagen around that area. And so this is why it tends to last a very long time. Now, we do continue to age, and so we keep on top of that. And so just because you get it done in the last 5 years doesn't mean that 5 years are going to go by before you need a little bit of a touch-up, although you'd be surprised. A lot of people come in and I see them 5 years later.
Yeah.
And
So in the meantime, they're coming in to maintain the quality of the skin. So they're doing like those energy-based treatments that we talked about, or some light resurfacing, because if they've already gone through the corrective stage to bring it to, you know, that optimal state, you only really have to maintain as long as you're consistent. It's every once in a while. It's not, you know, it's not a daily process.
Yeah, they come to the practice. They don't come to me for 5 years.
Exactly.
To fill 'em. It's
But
like
they're here. So the nice
they're
thing about,
family members.
right. So the nice thing about, like we were talking about earlier when we started about technology and advancements in technology, it's great because it allows us to be able to experience advancements in aesthetic technology so that it can help us, you know, bring our best self forward and feel good and refresh. And with many, like we talked about, require no downtime, and some require minimal downtime. Same thing in terms of advancements with the dermal fillers. You know, with the H8 fillers before, they lasted maybe 6 to 9 months, maybe 12. And now they're going more 12, 18, 24 months. And then now with Bellafill, up to 5 years, it's kind of a game changer. And so something that I did want to touch on is, we are seeing more and more male clients that are coming in, and they're very interested too in making sure that they're feeling good and that they're keeping their skin healthy. And so, which is interesting, because why is it that men or male skin responds much quicker to treatments?
Testosterone, baby.
It's the testosterone.
Testosterone, baby.
So they just come in, it's like, tell me what to do, you do it, and it's like, poof, it's like, you know,
do a
beautiful.
little Bellafill, they're happy.
Yeah, but the nice thing is, men are coming in for neuromodulators like Botox, cosmetic, and Dysport, and they're coming in for neuromodulator treatment, but they're also coming in for fillers because they want, you know, to make sure that they're looking the best that they can. And Bellafill...
And we'd like to thank Zoom, yes. We'd like to thank Zoom.
but Bellafill is one of the, I think, one of the go-tos of the male clientele, where they just want to be like, you know, I kind of, you know, just do this, and, you know, I'll be back when you tell me to come back. So
work on my skin, but I don't really like those needles.
Exactly.
But it's also a great product. I would have to say I'm one of the few doctors in the U.S. that's injected more Bellafill.
Yes, because you used to be a trainer for Suniva.
So at one point, I think I did 1,201 syringes in 1 year, which is insane. But so I have a lot of experience with the product. It's not a product that I would say a lot of people should be injecting, because it is an advanced technology product. But it is a great product, and it's a great option for, you know, individuals who, or if they're snowbirds and they don't really want to come back and forth. So, you know, we do have a nice array of products that really last a long time, especially where I seem to put them.
So you guys, I think, you know, we wanted to keep it at about 30 minutes and kind of give you enough information so that, I don't know, we hope it was helpful. We hope that it answered some of the questions that you may have possibly had in your mind. Even for our established patients and clients, hopefully this was informative and refreshing. It's always nice to get some refreshers and be like, oh yeah, that's right. Or, wait, I have to maintain my skin. I have to get in there. But if you have any questions, even feedback about the content of
or what
the
you'd like us to
subject,
talk about
or
the next Facebook Live, Instagram Live.
Exactly.
That'd be helpful for us, actually.
Exactly. That would be great. We are going to be doing a live with Nurse Danny next month, so tune in for that at the end of next month. But if you're not getting our newsletters, make sure that you subscribe. You can go to our website and subscribe to the newsletters, and that's how you'll learn about different events. And every once in a while when we have special offerings, you'll be the first to know. But please give us feedback, comments below or above or whatever platform you're on. But thanks so much for tuning in, and we hope to see you soon. Happy New Year.
Happy New Year.